Hi, this is Katie. In today's video, I'm going to do a little health update. If you've been following me for the last year and a half or so, you would know that I have a rare esophagus disease and I also have a benign liver tumor. And I have been going to doctors and getting procedures and getting tests done and doing treatments and all that kind of stuff over the last year and a half. And I just wanted to give you an update on what's going on right now because I went to the doctor yesterday and I got some news. And so I just wanted to do a little update here. So if you're interested in hearing about my esophagus disease, my liver tumor, and all that kind of stuff, I really hope that you are subscribed and I hope that you keep watching. Okay, so the quickest overview possible, because I've done a lot of videos on this topic, I will have like longer explanations linked up here. So if you've never seen any of my health videos, maybe watch one of these first. But if you have, or just need a little like refresher, just as a reminder, I do have a really rare esophagus disease that I got diagnosed with about a year and a half ago that causes a lot of issues just in my esophagus with really bad inflammation. It's an incurable disease, but it is treatable for some people with diet changes, with medication and stuff like that. And I've tried diet changes, I've tried medication, and those treatments so far have not really helped me. The diet helped a little bit, but overall, I still feel either discomfort or pain almost every single day with eating specifically, and sometimes even drinking water. And so in the video that I did, it was like 2 or 3 weeks ago or so, when I did a little update mentioning that I went to the doctor and that I got an MRI and all that kind of stuff, that was just a couple weeks ago. And in that video, I mentioned that I went to my doctor and that she said, yeah, like it's unlikely the diet's ever really going to help you. And if the medication doesn't help, it's really unlikely that any treatment is going to help you. And so it's kind of good for me to wrap my head around the fact that I might be in this type of discomfort or pain most days for the rest of my life. Not to have a pity party or anything like that, but just to kind of accept it so that I can learn how to live with it. You know what I mean? While also still definitely doing the treatments to see if I still can get better. But when I talked to my doctor a few weeks ago, she just made it seem like no matter what treatment I do, it is just kind of unlikely in my scenario. But when I saw her a couple weeks ago, she told me there were a couple more treatments that I could try. One was an inhaler that you don't inhale into your lungs. You actually just like spray it into your mouth and then swallow it, which is so weird. Like it feels so weird to do that, so that I can try that. There's a couple other medications I can try. And then there's a shot that I could try. Those are kind of like the last types of treatment for the esophagus disease I have. It's called eosinophilic esophagitis, or EOE. I don't think I've mentioned that in this video, but it's called EOE. And so the treatment that she started me on about a month ago at this point was an inhaler, and that inhaler is not really helping yet, but she says to just do it for 1 more month and to see if it will help or not. She said that's unlikely. And I talked to another doctor and he said it's unlikely too, but just still a treatment that I could try was this inhaler. And then she said the next treatment would be another PPI, essentially. So when I first got diagnosed with the EOE a little over a year ago, I was on a PPI called omeprazole, which is like acid reflux medication, essentially. And the omeprazole didn't really help me. It helped a little bit in the beginning, but then it didn't really seem to be helping at all. And I was on it for a few months. And so I just stopped taking that. And so she was like, let's try another type of PPI to see if that helps. Because in her experience, the people who are on PPIs who have EOE have the most likelihood of their symptoms decreasing. So she said that even though the first one didn't help, let's see if this next one does. So she put me on, it's like omeprazole, but starts with a P, pantoprazole. I don't remember what it's called. I didn't even pick it up yet because she just called it in yesterday. I got to pick it up today and I'll start that today. But she also said it could take 4 to 6 weeks to kick in. So I don't know. I am someone who does not like being on medication unless I absolutely have to, especially if there's something I can do within my own diet or lifestyle and change my diet or change my exercise routine or whatever. I would much rather do that than be on medication if it's possible. But now it's getting to the point where it almost feels like my EOE is getting worse. And I really don't want to ever sound like I'm complaining, but I'm sure sometimes I do because talking about chronic illness just sometimes is really difficult. Like the other day I had to like cough up food, you know, like it sometimes is really, really difficult to deal with. Okay. So it's kind of getting to the point where I feel like I'm going to start crying. It's kind of getting to the point where it's like, the pros and cons of being on medication versus still just trying to deal with this more like naturally with my diet and stuff. But the diet and stuff's not really working very well. So I think I think I'm going to try this other PPI for a few months. I just really it's just something with me. I just really don't love being on medication unless I really have to. So it's kind of just me trying to figure that out mentally. But I think I am going to try it and stay on it for at least a few months and see if that helps. Because if it helps, I have to decide if it's worth being on a PPI for potentially the rest of my life. Because in my own research, I have seen that being on a PPI for an extended period of time is not healthy for our bodies. So I just think I need to do more research on that that, because this is not a medicine that you're just on for a few months and you go off of it and you're cured, because it's not a curable disease. But it's potential that if I stay on it for, basically forever, that it could help me. But I just need to do more research and see. But anyway, so she prescribed me that. And then she's like, if this one doesn't work, there's a couple other medications that we can try. But then if none of those work, she said that there is an injection. And I asked her, because I remember her and like another doctor I talked to, or maybe just the other doctor I talked to, but regardless, I remember someone saying that the shot is like a long-term thing, but I didn't know any other details about it. And so I asked her, like, when you get the shot, you got to do it a lot, right? And she said, and I kid you not, she said that the shot is weekly forever. And I'm like, oh, I don't want to do that. That's not something that I want to do. Again, I would do a lot more research on it, but that just does not seem like something that I personally want to do. And also, it's not really common for people to even do the shot. So I don't know. I'd have to do a lot more research on that. But regardless, even if I did think about doing that, that would not be for at least 6 months or something like that. But right now, I'm going to try the other type of medication, and we're going to see if that helps with my inflammation, with my eating and stuff. But regardless, besides that, I do feel like it's getting a little bit harder to eat, but overall, it's basically the same. It's just something that's painful sometimes, really annoying a lot of the time. And so that's kind of just the update on that, is that I am going to try a new medication, which makes me nervous. I know a lot of people are on medication and they're fine with it. I just have always had like a weird nervousness with medication. I've taken some before. Obviously, I've been on antibiotics if I needed to, whatever. But like, it just weirds me out to be on like a long-term medication. Personally, it just weirds me out. Anyway, with my tumor. So a lot of you guys know that I have a liver tumor that I've had for like 12 years, I think. And it's in my liver and it's pushing on my stomach. And they realized that it was pushing on my stomach a year and a half ago through an endoscopy. And so they wanted me to get some more tests done, blah, blah, blah. I've explained that story a million times and it's unnecessary to explain it more now. Basically, there's a tumor in my liver pushing on my stomach. It is benign. Like, I've gotten told by several doctors that it is benign. However, since it's pushing on my stomach, they just wanted to do a couple tests and stuff to just kind of still make sure that it's okay in there, that it's not like harming too many things. And so I got an MRI about a year ago, and the doctor I got that MRI with, he was like, get another MRI in about a year. So I ended up moving and stuff, but I talked to this doctor about it and she's like, yeah, that makes sense. Get another MRI now so we can compare the two. Because if it's growing rapidly or pushing on things in a harmful way or whatever, then they might do something about it. However, if it's just kind of hanging out there, they're just going to leave it in, because that is a tumor that they literally just leave alone. In terms of liver tumors, I have the most common type of liver tumor. It's called FNH, focal nodular hyperplasia. And again, it's like 98% of the time they leave them in, unless they cause a lot of damage to other organs or anything like that. They might take it out, but that's super rare for them to take it out. Regardless, they wanted an MRI just to make sure. So I got an MRI a couple weeks ago. And so I went to my doctor yesterday and she checked the results and she basically said that nothing has really changed in the last year. It's only grown 1.4 centimeters even in the last 12 years. So I guess even the idea that it's pushing on my stomach is not really a big deal to them. I don't know. Again, I've talked to a couple different doctors about this and they seem like it's not really a big deal. And even the doctor that I saw yesterday, she's technically a PA. She even said she talked to another doctor and they're like, no, she doesn't need any more procedures or anything, because they were thinking that I might need an endoscopic ultrasound where they do like basically like an endoscopy and then an internal ultrasound, like the ultrasound imaging, but inside. And so they were kind of thinking that I might need to get one of those just so that they could see a different angle of my tumor. But after my MRI results and after the PA talked to a doctor in her practice even about it, they all just decided that I don't need the endoscopic ultrasound, which is what the doctor last year said, a different doctor. But anyway, so my tumor is just going to hang out in there. Again, I've had that for 12 years. It's grown a little bit, but right now it's 7.9 centimeters. That's gross. It is gross if I think about it, because that's big. It's in the middle of my liver, by the way. I don't know if any of you guys have questioned that. I can't feel it or anything. It's not popping out of my liver. It's in the middle of my liver. I think it's somewhere in between the size of a baseball and a softball, I think. But it's 7.9 centimeters. And it was 6.5 when they found it. And so she just says, again, with what she knows and that she talked to a doctor and stuff about it too, that I just don't need any more testing right now. I'll probably get another MRI in a few years just to check up on it. But at least for now, we're done. We're done with the tumor stuff right now. They're just leaving it in. And again, I know some people are like, it's unsafe to leave tumors in, or you need to get another opinion. It's no, this is such a common liver tumor. Literally one other person in my family has it and their doctors say the same thing. And I've talked to 4 different doctors about it. And it's all just no, it's fine. They do, again, need to monitor it every once in a while to make sure it's not growing or hurting anything. But besides that, they just leave it in and it's not hurting me. It doesn't hurt. I don't feel it, nothing like that. So they're just going to leave it in and I don't need to get any more tests. So basically now, the reason that I'm in New York, by the way. I mentioned that in a video from a week or two ago. I've been in New York for the last 6 months or whatever, but the only reason that I didn't know when I was leaving was because I didn't know how these doctor appointments would go. But since basically the doctor is like, well, you don't need any more MRIs, you don't need the endoscopic ultrasound, we're gonna try this medication, but it's gonna take at least a few months to even see if it's helpful or anything. So basically, I'm leaving New York in like a week or two from the time you see this video, maybe a week or two from the time you see this video. If you wanna guess where I'm going, you can, but I will let you guys know when I get there and do a whole video about my next little chapter in my life, because I do know where I'm going, at least for a little bit. I do know where I'm going at least for a little bit of time. But basically, the one thing that the PA did say is that it would probably be good if I get another endoscopy just to check on my esophagus later this year. So yeah, I'll probably do that in about 6 months or so, because we're gonna see how the medication works and all that kind of stuff, so they can check on my esophagus through the endoscopy, because that's how they diagnose EOE, is through a biopsy through an endoscopy. And so she thinks that it just could be good to check up on it. People with EOE do kind of get frequent endoscopies, especially when they're going through treatments, to see how, not frequent like every day, but like, you know, a couple of them. And I've had 2 in the last year. So it makes sense for me to get a 3rd, especially after trying treatment, to see what the biopsy comes back with. Because again, it's incurable and I'm going to have the disease technically forever, but there are certain treatments that could just make me feel a little bit better. You know what I mean? And just kind of would like change what the biopsy would show. So even though it's an incurable disease, technically like the biopsy could still change. And so like I would still have the disease, but it's just like how my body is reacting to it could change, if that makes sense. So anyway, that's kind of it. Tumor's fine. EOE, again, it feels like it is getting a little bit worse lately. I don't know why, but I am going to try this new medication. I'm very reluctant, but I do think that I am going to try it. And then I'm going to get another endoscopy just later this year at some point. So anyway, thank you guys so much for watching this video. I hope that you are subscribed. I probably won't do a lot of health videos over the next few months, but I might still do some food videos here and there. So I might talk about my diet a little bit, because I am on a very restrictive diet because of my EOE. But in terms of my health and stuff, I probably won't talk about, maybe until I have to get my next endoscopy, or if anything like really drastically changes, maybe I'll update you. But besides that, there probably won't be many health updates for the next few months. But yeah, I really hope that you are subscribed for travel videos, lifestyle videos, vlogs, and just hanging out with me. I really love having you guys here, and I really appreciate it so much if you subscribe and watch my videos. But yeah, I guess that's going to be it. Thanks again for watching, and I hope that you have a wonderful day. I love you, Jesus loves you, and I'll talk to you later. Bye.